Welcome. This is a production brought to you by the Idaho Commission on Aging.
So welcome everybody to the very first Falls Prevention Coalition of Idaho Steering Committee Collaborative, which is a really long word, and they wonder why we start using a bunch of acronyms as we work through these things. That would be why, but we are absolutely thrilled to have all of you here as we get started with the FPC-ID and making some hopefully dramatic changes to the incidence of falls in Idaho. Before we get too far down the road, I do want to let everybody know that we are recording. You should have got a little pop-up that told you that. That, of course, is for privacy. Know that everything's being shared. But the most important thing is it will be available for you to review, or if we need to share it with people who could not make the meeting. And we have a couple of places to do that. First of all, we have a literally brand new as in this morning webpage. Right now it's on the aging.idaho.gov website and /FPC-ID. That should make perfect sense to you. And that's where we will be able to, share these documents a little bit easier, maybe not have to send some things via email, also put out some information for those people that we are trying to reach. So take a look for that. And also we have a YouTube channel that we will be adding a falls prevention entry to. So we'll have a couple of different places where we and other people can see it. Next slide, please. So the question is, what are we going to do today? And the answer is a whole lot in about 55 minutes. So put on your seatbelts because it'll be kind of a quick ride, but hopefully a good one. I want to start off doing some introductions in just a moment because we do have a lot of people from a lot of different places, and the word coalition obviously means people together from different places. So we need to know who we are. Then we're going to move into just a little bit of history, not too much because I've sent you some documents already, but kind of where we were when we first started this, where we are now, where we're going, and following a framework that if you're not familiar with it, you will be at about 20 or 25 after the hour. Then we're going to get into the first work, which is not really work today. It's kind of fun. We're going to do a brainstorm that we will describe a little bit later when we get there, but that will definitely get you guys engaged and giving us your ideas and your thoughts. After that, we'll be just out of time. So we'll go ahead and talk about some different action items that we want to think about when our next meeting is. And then, of course, we will adjourn on time right at the top of the hour because we want to be respectful of you and your time. So with that said, Caitlin's going to move us ahead. Now, when we meet together like this, I know you guys all know this now, I just like to kind of repeat, we want to have meeting etiquette. The first one is please mute yourself when you are not speaking. People struggle with that for some reason. You can either click the microphone button, or I like the keyboard, Alt-M, M for mute will turn it on or off. Partly because I am blind and I can't see who is speaking, but also I think it's just useful in this environment. When you start to speak, if you can start with your name. So for example, Caitlin may be saying something, and I can say, this is Erin, and this is my idea, or this is my thought. That just makes it easier also for the person taking notes to know who is speaking. And of course, we always want to speak slowly and clearly. And we want to be respectful of others. So with that, we're going to move on down and get to the fun stuff, right? We always like the fun stuff. When we talk about, I need to get rid of a little window here. Talk about the Falls Prevention Coalition. There are a variety of ways that we can talk about this. And what I know is that many of you have worked in one way or another with falls, in your history. And I don't ever want it to sound like, we are the first ones to have this idea and we put it all together. But what I found a few years ago when I first started with the health promotion program and learned that there was even a Falls Prevention Awareness Day was that it didn't seem, or at least I had a hard time finding, kind of a coalition or a group or a network or anything. So developed, some things kind of on our own for ICOA. Went with a day and then a week and then a month. And we had the governor actually make a proclamation for Falls Prevention Awareness Month. That means we can do a lot of things in 30 days instead of just a week or one day. And of course, many of you are familiar with that because some of you have watched those seminars as consumers. Some of you have watched them as healthcare professionals. Some of you have presented, like Dr. Kinahan and Dr. Bates have both been some of our seminar presenters. So we've been building up, yet we still know that we can't cover it all. As you are all already aware, and I don't ever want to preach to the choir, there's many causes to falls. There are different factors that go into falls. It's different even in different areas of the state, what may be a priority. So in order to cover all of that, geez, we just need more than a month. And we also need to be focusing on it for more than a month at a time. We need to be focusing on it year round. So that's why we decided to go ahead and build a coalition and to kind of get it started where we can provide these things more regularly throughout the year instead of just hit and miss. So before we go on, because I realized I just got ahead of myself, I mentioned that many of you have been involved with some of the work ICOA has done or work on your own. So what we need to do is we need to go ahead and meet everybody. And I'm going to keep mine fairly short because most of you know me. But for you, what is your name? Where do you work? What do you do? Title is one thing, but a specific program. And then, is there something specific that has brought you here to work with us? And if so, what is it? So keep it fairly short at this point because we have a few of us. And I'll start leading by example. My name's Erin Olson. I work with Idaho Commission on Aging, got involved through the Disease Prevention Health Promotion or Title 3D program, doing falls prevention awareness seminars and things about 3 years ago. And I am just thrilled to have everybody here ready to work on reducing falls for Idahoans. So I'm going to toss it over to my colleague, Caitlin, who is going to take over, and then she's going to call some names.
Thanks, Erin. My name is Caitlin Gaines. I am Erin's partner for this coalition. I got involved in this when I was looking at the NCOA website and noticed that Idaho did not have a falls coalition. So I work in an acute care hospital as a PT, where I see lots and lots and lots of falls. So I am passionate about this work, and I'm really excited to meet all of you. So I'm going to go ahead and just start going down the participant list. So the first person on my list here is Yvette from the Alzheimer's Association.
Hi, everyone. My name's Yvette, and I am with the Alzheimer's Association at the Greater Idaho chapter. So location-wise, we serve all of southwestern, eastern Idaho, all of Idaho except for the very northern panhandle. My role at the association is helping persons with the diagnosis as well as their caregivers kind of navigate those questions and concerns that they might have, as well as refer out to community resources and get them in touch with the support networks that they might need. I've been working in kind of a navigator position for close to 2 years. Previously, I was with the Area Agency on Aging, working in conjunction with the Boise State Family Care Navigator Program.
Thank you, Yvette. Annabeth, next.
Did you
Hi there.
Hi.
I'm Annabeth Elliott, and I'm an RN. I also have a Master of Science in Nursing from Boise State, and I work for LINC, which is Living Independence Network Corporation. And the part of LINC that I work for is personal assistant services. And so people who would normally be in a nursing home can hire caregivers to care for them in their homes. So Link's overall mission is to help people live independently and live the life of their choosing. And so I know from my research on falls that falls is the number one way people do lose their independence. And so I would like to prevent that whenever possible. And before this job, I worked at Blue Cross as a care coordinator. And I noticed that when I would research people who had fallen and maybe they had injuries and maybe they didn't, but everyone always just said, oh, I lost my balance or I stumbled, but they never really looked for the cause. And so I really dug in because I'd like to help people become educated about what the cause might be of their stumbling or losing their balance, and so that they can really prevent it, and not just so many people just gloss over falls. It's like, oh, that was a one-off. So, and it's more than rugs, you know, throw rugs, that kind of thing. Not so easy.
Thank you, Annabeth. How about Bob Wood next?
Thank you for the invitation. Thanks especially to Sarah for connecting me with you all. So I am the Associate Dean for Research for the College of Health Sciences here at Boise State. And I have my area of investigation when I was coming up and doing all of my research was basically functional independence, and I did a lot of work in falls prevention, been trained in matter of balance, and also have had several meetings with Fuzhong Li and learning Tai Chi, moving for better balance, and implementing service learning courses in the community and working with seniors and those kinds of things. And so it's an area I'm really passionate about and would love to help. So that's why I'm here.
Thank you, Bob. How about Carolyn Yeager next?
Hi, I'm Carolyn Jager, and
Oh,
I'm
so sorry for
oh, it's
mispronouncing
okay.
his name.
I answer to both. It's completely fine. I'm up in District 1 with the health department, and I do fit and fall proof program for fall prevention in this area. So
Thank you, Carolyn.
Mhm.
How about Craig?
Hi, good afternoon. I'm not sure if my video is working. My name is Craig Jussel. I'm a physical therapist, and I'm a director of the outpatient services for physical therapy, occupational therapy, and speech therapy for St. Alphonsus through Boise, Idaho to Baker, Oregon. I am not a vestibular or balance trained therapist, but we have a number of therapists who have dedicated a good part of their careers to that endeavor. We have clinicians throughout numerous clinics who specialize in this area. We've been involved in, or our clinicians, I should say, who have the advanced training have been involved with fit and fall classes and instruction for multiple years. And we also work with our physician network through St. Alphonsus and balance screening and very kind of multidisciplinary kind of a service direction. So I'm excited to be part of this committee, and will certainly reassign this to one of my colleagues who has higher training and expertise than myself.
Thank you, Craig. How about Haley next?
Hey everyone, my name is Haley Merrick. I am a graduate research assistant here at the Center for the Study of Aging at Boise State. And my primary responsibility this year and the last 2 years, has been to evaluate the Fit and Fall Proof program across the state. Another endeavor that we had last year and are still working towards is getting the Fit and Fall Proof program as recognized by NCOA as an evidence-based program, and they are in the midst of adjusting their criteria to allow more programs like Fit and Fall Proof from states who don't have funding for RCT trials to be able to be considered evidence-based, as it's been established since, I believe, 2004. So that's my primary role.
Thank you, Haley. How about Gail next?
Hi, my name is Gail Hines, and I'm a physical therapist and a certified vestibular therapist. And I'm the program manager for Hearing and Balance vestibular program at Idaho Elks Hearing and Balance Center. And we are now part of St. Luke's. So I have been involved in vestibular for probably about 25 years now. And I'm just very excited to be a part of this coalition. I think there's the work that is being done here. There is definitely a need, and I'm just grateful to have been invited. So thank you.
Thank you, Gail. How about Jeanette next?
My name is Jeanette Olson, and I'm in the Department of Community and Public Health at Idaho State University. I've been part of several outreach programs in the region here, where we've used some of the Fit and Fall Proof programs and some of the PT faculty, as well as the local health department and some of our students, some of the other students from other programs within this area. So I actually look forward to working with you to help absolutely this need. There's a great need for many causes of why individuals will fall. And like I said, I've been a part of quite a few programs over here and look forward to working with you.
Thank you, Jeanette. I have Jay Clovis. Apologize, I don't have a full name.
Hi there, my name is James Clovis. I'm the Home Repairs Program Manager at Boise Valley Habitat for Humanity. A big focus of our program is aging in place, and we provide low cost or free safety and accessibility repairs to seniors in Ada County. Yeah, we have a huge interest in preventing falls to prevent displacement. So happy to be here. Thanks for having me.
Thank you. Jim Phelps next, please.
Hi, Jim Phelps, and like with Jay, I am with Boise Valley Habitat for Humanity. I'm the development director. So my role is to find the funding for James to do his good work. A little bit about my background. I did work with a large social service agency in California, where a huge emphasis was on aging in place and fall prevention. And I was there for about 7 years and helped with some cool stuff there. So I just hope we can do whatever we can to help prevent falls. So thanks.
Good. How about Kelly next?
Hi, my name is Kelly Borland. I am the Injury Prevention Coordinator for Trauma Services up here for Kootenai Health. I've been in this role for just over a year. And I'm interested in the falls because falls, of course, are our #1 mechanism of injury that we see here. I've been a nurse for going on 27 years. Most of it was on the other side of trauma. So I'm excited to be on this side of it and maybe prevent some of the things I've seen. So thanks for having me.
Thanks, Kelly. How about Jim Phelps next, please? Okay, we'll take a minute on that. How about Krista next, please?
Hello, I'm Krista Kramer, and I work with the Idaho Assistive Technology Project in Moscow. And I guess I got into this via some of the work that I'm doing related to communication access in long-term care facilities and medical facilities. And the assistive technology that can help prevent falls or help keep people safe and found if they do fall. And there's a whole spectrum of interest there. Things like getting PA systems available for all the fit and fall proof classes, so the folks with hearing impairments can be fully included. And, anyway, that's sort of my background and interest realm.
Thank you. I believe it's Dr. Bates, is that correct? Next, please.
Yes, hi everyone. I'm Dr. Rodney Bates. I am an internal medicine osteopathic physician. Previously practiced in the Rexburg, Idaho Falls area. Currently, I'm in Meridian, Idaho as a primary care chair for ICOM, Idaho College of Osteopathic Medicine, and also instruct our students or future physicians, hopefully, to Idaho in the geriatric syndromes, falls being one of those, generalized weakness and other disorders. So happy to be with you. I'm so excited to hear everyone's background. Thank you.
Thank you, Dr. Bates. How about Sage next, please?
Hi there, my name is Sage Stoddard and I'm the Director of Area Agency on Aging of North Idaho. So we cover the 5 northern counties. And we have a huge interest in falls prevention because it keeps our seniors healthy and also aging in place.
Thank you, Sage. How about Stephanie next, please?
Hi, everyone. I am Stephanie Shattuck, and I work at the Institute of Rural Health with Idaho State University in Meridian. And I'm the program director for the Traumatic Brain Injury Program. And I guess my interest in falls is when we're out, we're doing screenings. Typically, falls is one of the top causes for head injuries.
Thank you, Stephanie. And last but not least, Dr. Kinahan, please.
My name is Kinahan. I'm a geriatrician currently at the Boise VA, where I'm the medical director of our community living center, which is our post-acute care rehab site. I also staff our memory and geriatric assessment clinic. I developed an interest in falls during my residency when I was looking after a lot of older adults with hip fractures. And then during my fellowship, really enjoyed learning evidence-based interventions to prevent fractures in hospital. I previously had a fall prevention clinic at St. Al's and am looking to grow one here at the VA hopefully in the next couple of years.
Thank you.
Well, I don't know about everybody else, but I just want to say, wow, we have such a fantastic group of people from all the different various areas of falls that we need to take care of. And every time I hear one of you speak, I want to just jump right in and go, oh, how about this? So the ideas are rolling. So I hope they're good for you too. Then I have to apologize to my Caitlin for completely messing her up with her slides earlier, because once again, my sound completely stopped and I had nothing to reference by. Ow. Thank you, Sarah. Do you want to give us just a little bit more?
Oh, you know me, Erin. I'd be happy to.
Please do.
It's so lovely to see familiar faces on this call as well as new. We're always in the market for extending our network of supports for individuals across the lifespan. Sarah Taves, I direct the Center for the Study of Aging at Boise State University, also have the honor of teaching in our Masters of Public Health program, which Haley is a member of. Haley forgot to mention one thing that she's currently doing with the Fit and Fall Proof program. She administered a survey this spring to try to discern kind of the impact of Fit and Fall Proof programming on their engagement in isolation during the COVID pandemic. Now that Fit and Fall Proof is back, how are they valuing the program having been without it for almost 3 years? So I'm super excited to see Haley's results. I think she's got over 200 surveys back from participants.
Over 350.
Oh my God. Well, yay. Oh, I mean, and the fit and fall proof coordinators are just so amazing. I mean, Carolyn, my hat's off to you in District 1. What you all do is just so amazing to support these volunteer leaders. Yeah, it's been a wonderful, we've done the evaluation for fit and fall proof for the last, I think, almost 10 years. So we have a lot of history and information about the impact of a program that makes a difference in small rural communities with volunteer peer leaders, which just completely blows my mind in terms of how we access people. The other piece of the population that we think a lot about in terms of fall and injury prevention are family caregivers across the lifespan. So I think that's the other realm that we can impact as we think about prevention, is how do we not only focus on the individual that may have fallen, but also look at the surrounding supports they have, and how do we assure that their caregiver is not putting themselves at great risk of fall or injury. So I think this effort, Erin, that you're standing up has multiple impacts, again, across the lifespan. I'm so glad that Stephanie, that you're on board with the traumatic brain injury piece. I mean, that is a completely ignored population often in terms of supports and services. So really glad that you're here to represent that, lifespan perspective as well.
That's why I'm very excited about this group and the potential as well, because you're right, and I think all of us know it's not one thing, and it's not two things. It's probably 5 or 8 different things that we can do, and every one of us brings a piece of that. So as an example, using your data from Fit and Fall Proof, or how I got involved with Habitat for Humanity was, we need to be making those referrals. When Fit and Fall Proof is doing those home audits and they're finding safety issues, we need to be making the referral so that they can be resolved and not just identified. But I get ahead of myself because I get so excited. So did we miss anybody else on the introductions before we move on? If we did, speak now or forever hold your peace, or at least until next time we meet. Okay, then I'm gonna get my Caitlin back to where I was, which was I was talking about the kind of our history and some of the things we did. And one of the things I just wanted to give you, since Sarah had some data too, was that we currently have 19 unique organizations, 33 active members, 40 pending members, and 22 current steering committee members that are already involved in the coalition, and we were just formally recognized a month ago. So I'm very eager to be able to move on with all of those things. You can find out all of this stuff in some of those documents I sent you about, when we say we were recognized, who is that by, some of the organizations and things. Not critical that you know those now. That's why I don't want to take the time to do it. But I do want to now going to kick it back over to my very capable colleague, Caitlin, who is going to tell you a little bit about the development path that we are following.
Thank you, Erin. So I'm going to be really kind of brief because I really want to be able to take more time in the end for our brainstorming. But I just want to kind of tell you where we are right now. According to NCOA, we're kind of following an action plan, and we're currently in the formation stage. So in the formation stage, we review the national action plan, we identify key partners, we make the case for fall prevention in your state, and then finally we create a planning group. So just a little background on the action plan. It provides a framework for action for falls prevention across the nation. The purpose of the plan is to implement strategies and action steps that affect sustained initiatives that reduce falls among older adults. It's important to know that it was originally developed in 2007, and it has since been revised in 2015. So step 2, identifying key partners. Everybody sitting in this meeting is a key partner. So thank you guys so much for being here. Step 3, making the case for fall prevention in your state. We, mostly Erin, have created an entire document that outlines statistics and elements of falls and falls prevention. And so we're going to share that with you after the meeting today. And then the final step, creating a planning group, is all you wonderful people right here. So just some additional things in the background that we've been doing, creating a name and branding, logos. Aaron mentioned a web page that is currently underway as well. So the remaining stages for the coalition are the maintenance stage and the institutionalization stage. Okay, so really now we're going to start heading into developing mission, goals, and objectives. I'm going to let you kind of read what's on this slide, but I'm going to start getting stuff ready for brainstorming, because this kind of gives us a segue into what's next. Aaron, did you want to go ahead and take
Help
over?
me to push my button.
There you go.
I'm off my mute now. So with that very, very brief overview, and again, for those of you that are interested, all of this is in the documentation we'll provide you. For those of you who kind of say, that's nice, but don't really care, I'm okay with that too. You can know as much about how we're getting there as you want, but those are the steps that we'll be following. So what we want to do now is actually get all of you engaged in what will be the next step, which is, we can say we have a coalition. I think we're all very excited to have a coalition, but we need to know the why we're here and what we're trying to accomplish, and of course, how we can tell if we accomplish that. So we are going to do a brainstorm, and I know many of you have done brainstorming, used brainstorming. I'm just going to give you a brief overview of how we're going to work through this. It's going to be kind of a wide open free for all. In other words, you don't have to raise your hand or ask to speak. We're just going to let you speak. But when we get started, Caitlin is going to be our scribe, and we want you just to say, and then again, brainstorming, so let it roll. What do you think the goals, objectives, activities, outcomes, whatever the case may be, are that you think the coalition will or should provide? Now, please don't make this a dissertation. A word, a few words, maybe a simple phrase. And also, it's really hard for people, but we're not going to discuss it right now. We're just going to write all of these down. And then after our meeting, Caitlin and I are going to go through and kind of organize them and, put them into groups or themes or whatever seems to have come of it. But right now, we just want to have kind of a free roll of ideas. Is everybody up for that? If you are, let me hear you say yes. I hope that's a yes, because I didn't hear any. If not, it's going to be a really quiet 10 or 15 minutes or so. So Caitlin's going to go ahead and she's going to be just capturing this on, I think it's a Google Doc. And we are going to go ahead and get started. So who has an idea of what you think the coalition is, should be, should provide, should do, etc.?
This is Rod Bates. I'm wondering if just putting it in the comment section, would that be helpful, Caitlin, for gathering a lot of comments all at once? Or?
I think, well, that's a good question. I can continue to do it on this Google Doc, and we're planning on going back and record and listening to the recording as well. So I think this way is okay, but if it gets chaotic, then yes, we can definitely switch back.
Or if you feel completely ignored, which I hope doesn't happen.
Or that.
Well, since I asked, I'll throw out the first is community engagement.
So I'm going to say community engagement, and that's when Caitlin knows to write it down. Fantastic. Somebody else?
This is Gail. I would say continuum of care.
Okay, continuum of care. And I know all of you have ideas, because when you were introducing yourself, you talked about your ideas and your goals and what you'd like to see.
Go ahead, Bob.
I would recommend we use something like the RE-AIM framework to bring some definition to those concepts that we all, how we might assess all those concepts in a way we all kind of agree to or think would work for us.
Okay, and was that the RE-AIM framework?
Yeah, it's a framework for assessing basically it stands for reach, efficacy, adoption, implementation, and maintenance of community-based health programs.
Excellent. All right. Sounds good. Sarah, you put something in the chat, but I was talking, so I didn't hear what it was.
I was building off of, I think Dr. Bates's comment about community engagement, and that is inclusive engagement, and that's looking at abilities. I think Krista mentioned, you know, reaching out to those that maybe have hearing impairments and making sure they're part of this conversation. Language, culture. We've been trying to get, you know, develop the fit and fall proof for individuals of the Hispanic community, how to weave music into that to make sure that it's inclusive prevention efforts. I think the Native American population is another entity that we should be sensitive to.
Absolutely. So let's see, that was basically inclusive engagement, which we might also add ability, language, culture. And a couple more. And we actually do have some representatives from the Nez Perce tribe that are part of our committee. So yay. All right. Anybody else?
Kelly added empowering older adults and professionals in the community to prevent falls.
Okay.
This is Krista. Assistive technology, whether that is transfer devices, grab bars and ramps,
yes.
Assistive listening systems, personal emergency response systems. There's a broad range of assistive technology issues that sort of weave into the fall prevention.
So assistive technology is definitely another one of those broad categories. She also mentioned basically trip and fall hazard remediation with things like grab bars, carpets, lighting, all of the things that go into that.
And access to lift and transfer devices, again, as a caregiver injury prevention tool.
Absolutely. And Sarah mentioned caregivers. So we'll put down, let's see. There's that again, a whole bunch of stuff there. We can do caregiver support as well as caregiver tools. Maybe that's a couple different ways to look at it. And again, we'll be, you know, fleshing these out as we continue with our work.
My thought went with that. I'm so sorry. This is Jeanette. And I was thinking support network training. And so how to help the support network around those individuals to build onto that.
Okay, so support network training. And I believe I heard it, but then I didn't say it. Somebody earlier had said we need to have evidence-based programming or evidence-based education, like Fit and Fall, among others.
Well, what about incorporating master level or above students in development, dissemination, or also students in marketing and communications of programs and initiatives?
Absolutely. So student involvement. Excellent. We're getting a good list. Anybody else have any ideas for the outcomes we want, the types of activities or things we want to do? Do you want to be more formal? Mission, vision, goals, those kinds of things?
This is Krista again. developing resources for home modification options statewide, financial resources, labor resources, all of those sorts of issues.
So financial, labor, and we'll throw in materials too. How's that? Financial, labor, and materials resources for hazard remediation.
And people to actually come into homes and help them do the assessments.
To do the assessments, okay, so we need home safety audit.
Yes.
People. All right, there were a couple of things in the chat and I apologize if I missed them. I think one of them was about evidence-based programming.
Explore suitability of a variety of evidence-based programs, and then also continuing education for medical providers.
Excellent. So we'll put both of those down. Continuing ed for medical providers. And Dr. Bates says to become involved in some research initiative, which is also what Sarah was talking about. And then ensuring that we have a variety of programs available of evidence-based. And if it's okay with everybody, I use EVP, evidence-based program, because it saves some typing. So if you see that, that's what that stands for. So I'm glad to hear that we've brought in, you know, the healthcare professionals and the soon-to-be professionals, which are the students, as well as consumers. We have some things about education. We have some things about remediating trip hazards. Is there anything else that you guys can think of off the top of your head?
This is Gail. I think I would add fall prevention screening, better access,
excellent,
better networks screening.
So falls prevention screening.
Gail, you read my mind. You read my PT mind.
We do think alike sometimes.
Yes, 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 yes.
Hi, this is Kelly. Just along those same lines, the fall prevention screening. I'm just wondering if there's a way to, I'm not sure how much happens in the clinics, but if there's a way to improve their workflow to make it, you know, easier for them to do those screenings.
Mm-hmm. Okay, so maybe we'll put consider effective workflow for healthcare pros. How's that? For now. Because you're right, we got to make it easy and it can't take any extra time, right? Anything else you guys have in your head? How about, you know, any specific activities or things you would like to see, you know, outreach or events or participation that will help us accomplish any of these things? So I'll put mine in. I'm going to say that we want to do regular consumer and professional seminars. And we'll decide what regular means.
And are those volunteer? I'm assuming you're not, and free and in-person, virtual, I guess.
We can do the whole gamut. That's part of the planning process of, you know, how do you reach the most people? What's gonna be most effective? And sometimes that's in person, sometimes it's virtual, sometimes it's hybrid, depending on who your audience is. Yes, and you know, we always try to make things at no cost if we can possibly do it.
And it's powered by volunteers.
So developing volunteers, that sounds like a good one.
This is Jeanette, and there's a piece of that's going with using students for research initiatives, but there's also outreach programs with a lot of the medical fields within, Pocatello, Boise. Anyway, we've got a lot of medical fields that those can go into outreach programs, because some of those screenings might be best in the community where they're easier access.
Right. Okay. Did you get that, Caitlin?
Yes, I will write that one. I was writing it down somewhere else. I'm sorry. I was doing a chat here. Just a second.
And we did get a good chat suggestion. Is that the one you were reading, Caitlin?
Yes.
Okay. Do you want to share it?
Well, actually, give me just a second. I want to head back to Sarah because I think she was asking you, Aaron, more about volunteers for this fall prevention seminars. Am I correct in that, Sarah?
This is Sarah. Yeah, Caitlin, that's right. I was getting to the point that these would be dependent on volunteers to do.
Yeah, and I think Aaron, she was just asking that question, not necessarily as an idea, but I think we were just trying to figure out how that was going to be run. So,
well, we got to figure that out.
Yes, I was being a little distracted, so I apologize. I was trying to
no worries. We can see it happening all kinds of ways, and that'll be a big area of our discussion, I think. Any other ideas? All right. Well, I think, did somebody have one?
In the go ahead, Sarah. You're good.
This is Sarah again. So this is for the this is the purpose of the steering committee, or is this the purpose of the I'm sorry, I just need a refresher in terms of what my focus is here that you're asking us to brainstorm about. Are you the impact?
This is the big kahuna. This is the big picture. What are we looking for from the Falls Prevention Coalition of Idaho?
So, Aaron, this is Sarah. I mean, based on that, can you provide us with what are some of the best practices that coalitions do in this area? I'm very interested to build on the knowledge and expertise of others. I don't want to reinvent a wheel.
Absolutely.
So
I am going to put that in the parking lot for just a minute, and I'll tell you why. Because don't ask me the exact appendix. I think it's appendix 2 or 3 in the Falls Prevention Coalition Toolkit has best practices. The whole formal list. And I'll when I email those other documents, I'll be sure to tell you exactly which document has that and where it is. Because you are correct. And one of the reasons I asked it this way is because, I obviously have ideas on what I would like to see happen with this. I've been thinking about it for 3 years. But what we also know is I am just me. I live in Boise. I do not live or have to work with people, across the state that have different needs, different issues, different concerns. You guys, many of you are either out in the field as a PT or a physician or meeting with customers and clients. So it's those various viewpoints that are the power behind the coalition. So I purposefully didn't want to give you a lot of direction, just to see what you guys could come up with. And like I said, what we will do is we will go ahead and, like I said, organize these, kind of find some themes, pick up the ones that you guys are putting in the chat right now, and we'll integrate those. And then at our next meeting, we'll have something to present. I guess that's what this will be, is our starting place to start defining what our mission, vision, goals, objectives, etc. are going to be. So if you have any last minute ideas, Caitlin, I think there's 2 or 3 that were just added to the chat.
Yeah. and I am getting those in now. Just
Okay.
copying and pasting those.
When you get a minute to get back to the PowerPoint, if you want to,
Yeah.
that would be fine. If not, then we can go on, even though I keep forgetting you guys can't see me. But we are at that point, and actually we are right on time to the minute, which is amazing. I just wanted to propose some action items. I know that I promised all of you when you agreed to be part of this endeavor that I would do my best to keep it, kind of independent, not have too many structured times and things, because we're all busy and we just need to do things in our own time. So some of the action items that we can be doing is, first of all, continue to familiarize yourself with the documents I've sent via email. I will send a couple more, which is the actual updated 2015 National Action Plan, as well as the Why Falls Matter in Idaho document. So you have those. We also will have those. I'm hoping to have those posted to the website by this afternoon so that we can get to them there as well. When our recording is available and posted, I will send you that link too. So continue to just kind of familiarize yourself. Like you said, if you're not familiar with it at all, that'll kind of let you know how we're going. Caitlin and I are going to go ahead and refine those ideas and combine them with the known best practices so that we will have a starting point for our next collaborative. I would also like all of you to just kind of think what your, best skills and talents are, and how, given our list of things we want to do, you might best be able to work within the coalition to help us identify those. I don't like to call them work groups. We're going to have a different name, but I'll tell you about that later on. But we will be putting together some different groups that can work kind of within the steering committee to get this ball rolling, to get us a good active coalition sooner rather than later. Almost lastly, if you guys have any ideas for people who should be or would like to be part of this group, please let us know. When I send out your email, I'm going to send you out a list of the current organizations that we have representatives from. And so then you'll be able to say, oh, wait a minute, there's nobody from this organization that I know of. That's really that kind of the reason for that. But they can either be recommended for a steering committee position or as just a regular member of the Falls Prevention Coalition. Finally, stay enthusiastic. I loved your introduction because so many of you were excited to be here. You said things like, I've waited, or we've needed this, and that's my feeling too. And we really want to build on that enthusiasm and engagement to keep us going. So I want to thank you for your time and contributions, and remind you or let you know that our next collaborative is on, I got to get my months right, it's March. So April 18th, which is the third Tuesday of the month. And I will be sending out, I'm going to send you basically one email with several things in it, but I'm also going to send you a calendar invite that will have this meeting and the time and all of the information, so you don't have to go back and enter that on your own. So with that said, I want to do a quick thank you to everybody who joined us today. It's been fun. I'm so excited and to hear from all of you and have us all in a group, and let you know that if you have any questions, please feel free to ask myself or Caitlin. You have our information in all of your emails that you've been getting, and I'm going to hang out until everybody's gone. So if you want to chat about anything, hang out. Other than that, thank you all and have a wonderful day.
Thank you for joining us. This has been a production brought to you by the Idaho Commission on Aging, supporting the well-being of aging Idahoans since 1968. For more information on resources to stay at home, stay healthy, stay safe, and stay informed, visit our website at www.aging.idaho.gov.